today I want to talk about pubic bone pain. Pubic bone pain happens often in pregnancy. It is more likely to happen if you've had it in your first pregnancy to happen again and sooner in your second and third subsequent pregnancies. And if you're not pregnant, you can have it, but this is often something I see with pregnant women. The way you know you have it is if you have pain right here, right in the very center of your pubic bone. That's usually where the pain happens. Now you can have pubic bone dysfunction or pubic symphysis dysfunction if you're having pain down your legs or just general pelvic pain or even pain in your lower abdomen. But in general, you'll know you have it if you can pinpoint it just on that one spot. Let me show you here where the pubic symphysis is. It's right here in the middle of your pubic bone. So you have, this is your pubic bone, and then you have this disc right in the center here, and that holds your pelvis together, or it's part of what holds your pelvis together. When you're pregnant, your body starts to put a lot of relaxin in your joints and ligaments. And so what that does is it allows this area to open up, which is good. That's what we want to happen when a baby comes through. However, if because there's a lot of instability there, it might be some of the things that you're doing that can cause inflammation of this or of this disc here, or pain in general. So what I want to do is explain to you things that can make this worse, and then things you can do to help prevent it or to improve it if you have it. So if you have this pubic bone pain, the first thing you want to do is pay attention to how often you're standing on one leg. Because when you're standing on one leg, that pubic bone will start to shear and you'll start to put pressure on one side and your pelvis will become unstable. So the first thing that you can do is try to keep both feet on the ground at all times. If you have to put your pants on or take your pants off or anything like that, then sit down on your bed or sit down on a chair and do it. This isn't forever, this is just while you're pregnant. Another thing to do is pay attention to how often you go up and down stairs. Going up and down stairs will start to move your pelvis in this way, and that can cause a lot of pain. Some people get pain just from walking, and my goal is to get it to where you can walk, but if that's hurting, what you can do is take shorter steps. So you just walk shorter instead of these long strides. Long strides are going to cause more of that imbalance on each side of your body. Refrain from doing any lunges. Any kind of exercise that you're doing, you want both feet planted firmly on the ground. A lot of people, when they stand, tend to lean their weight on one side of their body versus the other. This can cause dysfunction or pain in that area. So really, there's a lot of things you can pay attention to. Another option is to act like you have a mini skirt on. So you just always want to keep your knees together so that your legs move as one unit versus moving, kind of moving in one direction on one leg. So pay attention to all of those things. And then things you can do to help strengthen that area would be these simple exercises that I have here. I like to use a yoga block for this, but you do not need to go buy a yoga block. What you can do is have a ball with three different size balls, or have your spouse or your partner hold your legs in 3 different positions. And so there's a lot of options besides just having a yoga block. But what I like about the yoga block is there's 3 different widths to it. There's this width, and this width. And so what you would do is lie on your back, and you just keep your knees bent, and you put your block in between your knees and squeeze. And you can just start with holding for 10 seconds. After you're done holding for 10 seconds, then you would switch to the next length and hold for 10 seconds that way. And then switch the next length and hold for 10 seconds that way. This could possibly reset your pubic bone if it's very uneven, and it's a very gentle, easy way to reset it. And it will also start to strengthen the muscles of your inner thighs, which will hopefully help hold everything together as well. This you can do several times a day if you like. And then the second thing you're going to do is you can take a belt or a yoga strap. This is just a cloth belt that I have. And what you'll do is you'll do the same thing, but you'll do it by pulling out. So I just wrap this around and then pull out for 10 seconds. And then I'll make a longer length and pull out and hold for 10 seconds, and then do one more length. This will help to strengthen on the outside. So that's a very simple exercise you can do for pubic symphysis pain. But really what you want to think about is, when are you moving in that way where your pubic bone could separate? If you can see on here, if we put one weight on one side of the pelvis, then it can cause shearing or separation here. And so really just keeping your feet firmly planted on the ground will be very helpful. A lot of times pubic symphysis pain is due to pain in your sacrum, or I'm sorry, not pain in your sacrum, but fixations in your sacrum, or your sacrum's inability to move, and that's why this area is overcompensating, because it's stuck over here. Chiropractic can help release these fixations and get everything moving again, but in the meantime, just try not to do anything that's going to exacerbate this. What I found is it's not something that you want to try to just make it through or push through, or make sure you're getting your exercise or anything like that, because it can cause, it can take a really long time to heal. After you have the baby, I've had people, for me it took a year to heal, because I was always in this lunge stance when I was adjusting people. I've had other people it take 2 years to heal, so it's not something that you just want to take lightly and assume you'll get better as soon as the baby comes out. Hopefully you do, but in my opinion, if it keeps getting worse and worse, then you need to be doing less and less of the things that exacerbate it. All right, I hope that's helpful, and please email us or call us if you have any questions.